Hi, good morning. I'm Dr. Umashankar, a cataract and refractive surgeon at Aloka Eye Clinic in Dubai. Today, I just thought I'll say a few words about cataract. Cataract is one of the common eye conditions, very prevalent among elderly, but you can see them even in 40s. So, if someone has a blurring of vision about 40 years of age, then cataract could be one of the potential diagnoses. So now, many patients ask me when they come for a consultation, they ask me when should we operate a cataract. So my answer is cataract can be operated at any stage. Unlike in the past, we wait for the cataract to mature, ripe, all those things have gone now. So you can operate cataract at any stage provided you have symptoms due to the cataract. So what are the common symptoms? You can have blurring vision, like as if you see through a fog, or you can have some kind of what you can say that you know like scattering of light when you drive in the night. So, and sometimes people can have even double vision, very rarely. So all these are the symptoms of cataract. So if you are above 40 and if your vision is not getting corrected with your glasses or something, and then you need to check with your doctor to see whether you have a cataract, and if the cataract is causing symptoms which is affecting your day-to-day life, then you should go for the surgery. So what kind of surgery it is? Surgery is a day surgery, very simple. The turnaround time can be as less as 2 hours. Surgical time can be around 15 to 20 minutes. Sometimes it can be more depending on the stage of cataract, cooperation of the patient, so many factors. So it's a simple procedure, and usually we do it under topical anesthesia, which means we put the drops and the patient doesn't sleep. We do the surgery. So most important thing which the patient needs to know is what is the type of implant we use. This makes all the difference. This is what the patient needs to know. So the implant can be monofocal, multifocal, and there's something new called EDOF. And this monofocal lens typically corrects the distant vision, and for reading they need to wear glasses. But nowadays there are some enhanced monofocals lenses which can partially correct the vision for even for the intermediate distance. So it's important for the patients to know the details very clearly. And the next comes the premium lens called multifocal, which has got rings on the lens. And the biggest advantage is you can see all the distances clearly, distance, near, and intermediate, and your dependencies on glasses is almost gone. It's fantastic lens. But the problem is you can have halos around the light, and it's very, very important to know this point. Okay, because there are instances where the people get really stressed after getting the surgery done. They realize that the halos they cannot handle, and very rarely even patients may go in for an explantation. So this is something which you need to know. And the new lens called EDOF is extended depth optic focals. These lenses are like monofocal, but it has got some features which can make you see even the near vision, close to near vision. It's almost a replacement of multifocal with the biggest advantage of not having the halos around the light. So this is the, I will say this is a big milestone in the intraocular lens implants. And there is something else called toric lenses, which is for specifically for people who have corneal astigmatism. Astigmatism means that the corneal curvature is like one axis is steeper than the other, then you get a cylindrical power, so which also can be corrected during the cataract surgery, and that lenses are called toric lenses. So these you need to go in detail and discuss with your surgeon. So finally, okay, surgery is done. What about the post-operative care? Post-operative care, the most important thing is the risk of infection. Nowadays, the risk of infection is like close to zero, thanks to the sterilization technique, infection protocols, and so many things, and patient awareness. But still, we need to be very, very careful. The post-operative hand hygiene is important, applying the medications in time, and you'll be fine within a maximum period of a week's time. You can drive, you can do all the activities without any problems, unless you have some additional problems like corneal edema or inflammation post surgery. So these are the important things which you need to know about a cataract, this journey. I'm very happy to talk to you. Anyone has any doubts about cataract, about the diagnosis, about the surgery, the process, anything, please reach out to me. No problem. Thank you.